Okay, now what we're going to talk about is the bones of your spine, how they're hooked together by ligaments, and how these ligaments age over time, which can cause problems that are related to arthritis. So let's get started. These are the bones of your spine. Here's a front view, one bone, another bone. This is where the disc space is over here. Side view, remember the facet joints from the last tape. Here's a little nerve coming out, a nice big wide open foramen. And this is the back view with the lamina that we talked about last time. As we are born, we find that our bones are hooked together by this nice rubber band-like structure over here, which is sort of hot melt glued to your bones themselves. It's a nice elastic structure. It allows your bones to move past each other as you turn your head side to side, as you nod your head in agreement with me, and every time the bones move past each other, the ligaments come snapping right back into shape. So the bones are moving and they snap right back into shape. And this is a very nice system, and it works very well up until we're about age 20. But then things start to happen. So we started off in our 20s with nice elastic ligaments holding our bones together. Everything moves, but it snaps right back. As we age, however, what happens is that the elastin molecules in the ligaments get replaced with fibrin molecules, and the ligaments start resembling rubber bands that got stretched out too much. And as your bones move past each other, as you're listening to the Stones, I can't get no, ow, okay, things start grinding past each other. Your body doesn't like that, okay? Your body does not want your bones grinding past each other in this fashion. So it's got to do something. And what the body winds up doing is actually pretty ingenious. What your body will do is it will take the bone, the disc space itself, and it will collapse that disc space right down until those bones are touching each other. You see them touching each other right there? Okay, and then what it's going to do is it's going to lay calcium and extra ligament right down on that disc space, right where any joint is, and it's going to hold those bones together just by laying down calcium, hard, solid calcium, holding those bones together, because it doesn't want them grinding past each other. But look what happens when you do that. We're going to turn this over to the side over here a little bit here. You see these ligaments over here? You see how they sort of buckle? Okay? Buckle, 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 and your body says, ah, that's terrific. I've got a little extra ligament over here, so I'm going to lay calcium on top of this extra ligament over here, and back here, and in the front here, and actually in the back of the vertebral body here where it's buckled, we're going to lay extra ligament, no problem. So it has all this extra ligament that it has, it calcifies it, lays down extra ligament on top of that, calcifies that, and at the end of the process, your body is extremely happy because your bones are totally hooked together. They are totally solid. They're not grinding. You can listen to as much Mick Jagger as you want, and you're not going to be in pain from your bones grinding past each other, okay? So now your body is happy. It's got the bones solidly fused together by laying down extra ligament and extra calcium all the way through here, and your body's totally happy. You can go to as many mosh pits as you want, you can listen to as much Stones as you want, and you're not going to move those bones back and forth. It is as if your body had duct taped your bones together, okay, with calcium and extra ligament. And that duct tape actually works pretty well. It's laid down all around the disc space in the front. It's laid down around the facet joints and back. It duct tapes some of the spinous processes together. Actually, way in the back here, it duct tapes the back of your vertebral bodies together as well. Anywhere your body can find a joint, it lays down some duct tape. And your body's totally happy about that, okay? Sometimes, however, you are not. And let's talk about that, because this process of your body trying to fix its bones together so they don't grind is the arthritis process. And that is the process that can cause you problems with pain in your arms or dysfunction of your spinal cord, known as myelopathy. So let's look at this for a second. Let's go back to when we were 20 years old and we had stretchy ligaments. Okay, we'll look on the side here where the foramen is in front of the facet joint here, and this nice little nerve is flying in the breeze in that foramen. It's got lots and lots of room to flop around, no problem, okay? Well, if you take that same facet joint and you wrap a bunch of ligament and calcium on it, it's like you're throwing extra bits of duct tape around that joint, that little hole, the foramen, gets smaller and smaller, and your nerve has less and less room to squeeze out, going from your spinal cord to the rest of your body. Remember, the nerves are the information line that communicates your spinal cord with the rest of your body, okay? So not only are your nerves getting squeezed here, which can cause you pain and weakness in your arms and legs, but also look in the back here, okay? This little hole is the spinal canal that your spinal cord runs through, and you have this big wad of duct tape back here that represents the calcium and the ligament your body laid down on the back of the body's front, back, in order to hold those bones together. Well, that big wad of calcium and ligament can actually start squeezing on your spinal cord as it's trying to sneak past those bones. And that can cause compression of the spinal cord, which can lead to what is known as myelopathy, or functional problems directly related to your spinal cord getting bothered. Okay? And that basically is why arthritis can bother you in your spine. It's because your bones are trying to hold themselves together, and they do so by laying down extra tissue, extra ligament, extra calcium around all the joints it can find, around the disc spaces, around the facet joints over here, around the back of the vertebral body. And it works great to hold your bones together, but the problem is, in holding your bones together, it lays down all this extra tissue, which can squeeze on your nerves coming out the side, and can squeeze on your spinal cord, trying to run down the middle and have your brain talk to the rest of your body.
Okay, so the usual disclaimer: you watching this video does not make me your doctor. Use common sense. If it hurts when you do that, don't do that. And always keep in contact with your own healthcare provider throughout this. So we are all over the web. We have a very active Facebook page with our patients. We are big time tweeters, and we are way into Instagram. To see more videos about anterior cervical discectomy surgery, general spine info, our blog, or to contact us, just hit us at DoctorRodz.com.